The term joints refers to a set of anatomical structures that connect two or more bones, allowing movement and stability of the skeleton. Divided into fixed, mobile, and semi-mobile, joints are formed by fibrous and/or cartilaginous tissue, ligaments, capsules, and membranes. However, when one of these components becomes inflamed or damaged, joint pain, swelling, stiffness, and movement limitations can arise. The main causes include some rheumatic diseases, such as arthritis and arthrosis, but also age-related wear and tear, some infections, and various traumas. Nutrition also plays a very important role in the health of our joints, as what we eat can increase inflammatory states affecting them, and at the same time damage the structure of the musculoskeletal system. There are in fact some foods that should be consumed in moderation to reduce the risk of the onset or worsening of joint pain. In this first part of the video, we will see some of them. Foods rich in salt. Under normal conditions, our body needs small amounts of sodium, a mineral essential for the proper functioning of the human body, as it maintains water balance, regulates the passage of fluids and nutrients in and out of cells, and also contributes to the transmission of nerve impulses. However, excessive salt consumption not only increases the risk of hypertension, kidney disease, and cardiovascular diseases, such as stroke and myocardial infarction, but has also been shown to damage the joints. This is because, according to a study published in the well-known medical journal, the Journal of Clinical Investigation, excess sodium in the diet promotes the activity of macrophages, a type of immune cell involved in inflammatory responses. It thus increases the production of pro-inflammatory cytokines that contribute to further deterioration of the joints and increase the risk of certain diseases, such as arthritis and arthrosis. More than half of sodium, 54%, is contained in preserved and pre-cooked foods, added in particular during industrial preparation. Among the richest sources of salt, we therefore find canned foods, such as soups and ready meals, preserved meat and fish, as well as salty snacks, such as chips, popcorn, and crackers, and finally sauces, such as soy sauce, barbecue, and ketchup. Among the foods that are consumed in greater quantities and therefore add more salt to our diet, we find bread, cured meats and sausages, in particular raw ham, salami, bacon, and speck, as well as seasoned cheeses such as feta and taleggio. Excessive salt consumption can also lead to increased water retention in the body, thus increasing pressure on the joints, which in turn worsens pain and swelling. Some studies suggest that a high-sodium diet can alter the structure of connective tissue and interfere with collagen synthesis, compromising the health of ligaments and cartilage. The result will be increased pain and reduced joint function. The guidelines dictated by the World Health Organization, in fact, recommend consuming less than 5 grams of salt per day, between that added and that already present in foods. Red meat and processed meat. Rich in high biological value proteins and essential nutrients, such as iron, zinc, and B vitamins, red meat has been at the center of numerous debates for years, not only scientific, but also ethical and cultural. Epidemiological studies show a correlation between diets rich in animal proteins, especially red meat and processed meat, and an increased risk of developing certain pathologies, such as diabetes, cardiovascular disease, obesity, and certain cancers, such as stomach and colorectal cancer. Recent research has also associated excessive consumption of red and processed meats with worsening joint health, as they appear to contribute to inflammation, a key factor in joint pain and disease. This has led to higher levels of some inflammatory markers, such as interleukin-6, C-reactive protein, and homocysteine. However, visceral adiposity, and in particular abdominal fat accumulation, accounts for a significant portion of the associations between red meat consumption and inflammation. This suggests that the negative effect of red meat on joint health may not only arise from the meat itself, but also from increased body weight, which thus contributes to chronic systemic inflammation and thus to the development of osteoarticular pathologies. However, saturated fats present in foods of animal origin, including red meat, are also under accusation, as well as polycyclic aromatic hydrocarbons, preservatives and additives, such as nitrites and nitrates. In the processed meat group, we find those meats that have been subjected to some processes to improve the flavor or preservation, such as smoking, salting, drying, or fermentation. Some of these are cold cuts in general, frankfurters and sausages, but also canned or salted meats. In the red meat group, we find beef, pork, veal, lamb, mutton, and others. General guidelines recommend consuming no more than 2 to 3 servings of red meat per week and avoiding, or at most limiting, the consumption of processed meats. Foods rich in saturated fats. Butter, cream and fried foods, sausages, meats and fatty cheeses are just some of the foods that contain a high amount of saturated fats. These are fatty acids found mainly in foods of animal origin, but we can also find them in vegetable oils, such as palm oil and coconut oil. Saturated fatty acids are known to increase total cholesterol and bad cholesterol levels, consequently increasing the risk of cardiovascular diseases such as myocardial infarction and stroke, as well as type 2 diabetes, fatty liver, and some types of cancer. According to the results of a study conducted in 2018 by some Australian researchers, excessive consumption of saturated fats, in addition to promoting weight gain, and therefore greater stress on the joints, can trigger the production of pro-inflammatory cytokines. Not only that, a high intake of saturated fats can interfere with the metabolism of omega-3. In fact, they have been shown to reduce pain and joint stiffness, as well as the degradation of collagen and cartilage. A diet high in saturated fat, for example, has been linked to an increased progression of knee osteoarthritis, a degenerative joint disease that occurs when the cartilage tissue that protects the joint is damaged. According to the guidelines dictated by the World Health Organization, saturated fats should not exceed 10% of daily calories. Unsaturated fats should therefore be preferred, which are found especially in oily fish, nuts, and olive oil. In conclusion, to preserve joint health and reduce the risk of developing some degenerative joint diseases, it is important to reduce as much as possible the consumption of the foods we have just seen. In a future video, we will talk about foods that protect joints, reducing pain and stiffness.